Anyway, coming to the workshop. So being a SIM educator, there are a few things you must keep in mind when you are learning some skill. The first and foremost is the psychological safety, which is not there in India. What do I mean? Like, you should feel psychological safe when you are learning a skill. You should not feel like hesitant or ashamed and keep in your mind or keep it to with you only and go back that I wanted to ask this question, I should have asked. So there are no stupid questions, because if you have heard about IOL, how it was invented. So there's the doctor, I think there's Harold. So one day, like, it was during Second World War. So the pilots were coming with all kind of eye injury, and the that window pane of the fighter jet was of some inert plastic material. So they used to get inside after bombing, and the doctor used to remove that. One day, that one of these specs got into the lens of the pilot, and then they were discussing the case. The student asked him, "So are you going to remove the lens?" So then he thought, "What stupid question you are asking? How can I remove the lens?" Then he went back to his house, and he thought, "Yes, if I remove his lens and put the something like that with the same material, so will that work?" So with that idea, he went to an optometrist, and they made a artificial lens, and this is how IOL was invented. So there is no stupid question, because initially the doctors thought that it is a stupid question. Even the student was embarrassed. So this is what, like, you should feel psychological safe, which is not there in India. Second is the gradient, the hierarchy gradient. So like, somebody is very senior, you feel little bit tight, like you are not going to ask questions. So this hierarchy gradient is not there. It should not be there. It is there in the army, but not be there in our medical field. You can ask any question. And for instructor also, like, I would request to establish a just culture. This is not just culture. Like, you can ask anything under the sun, and he should not get annoyed. He should not get frustrated. How many times I have to tell you this and that. So these concepts, psychological safety, the hierarchy gradient, and this just culture, we need to inculcate in our teaching, right? And then there, I will not go into detail. There are Cope cycle of skill learning. So first, like, when Dr. Mandeep demonstrated skill, so this is known as like keen observation, close observation. Then this is a process of mental visualization or mental rehearsal. You must employ this mental visualization, mental rehearsal when you are learning the skill. This is very important. So you see the skill, you then reflect upon this, like how it was done. Like, he took this blade, then give the incision, then this and that. Then you reflect upon that. Okay. First you observe, reflect, and then you have some sort of. So we have a casualty here. I think it's too boring, my lecture. Can you wake him up? Jago Mohan Pyare. So, like, reflection, some kind of abstract conceptualization. It's not exactly like you are going to do the procedure, but kuch hai yaar, like you have to do this, that, that's it. Like, you have some kind of abstract conceptualization, and then you have concrete experimentation. So these are 4 stages: observation, close observation, and then reflection, and then your own thoughts, and then active experimentation. Okay, so these are the 4 things. And mental visualization, keep on mental visualizing the things which they are doing. Keep mentalizing. Okay, then we will talk later at this station, right? So feel psychological safe. That's my personal request. And do ask many questions, as many as you can. Let it be a stupid question. Maybe you will lead to some innovation. Because I'm in innovation, I have designed Indian banking. I'm a RA expert, also focus. I do a lot of work. And innovation is my field now. How intuitively we can think. So there is not one thing of doing a particular procedure. Like, sometimes I fail in plane approach. I do out of plane approach. And that's not described in literature. Lumbar plexus block. I do out of plane. So it depends. But learn many technique, master one at least. Master one. That should be your motto. Learn as many as you can, but master one technique so that you never fail. Okay? Thank you.